Please give us a little background about your qualifications, where you went to school, and how you got into midwifery.
Okay, so I did the usual with high school and went on to the University of Vermont. The reason that I chose that as a college of nursing is because their emphasis was especially public health. And Vermont was a rural community. I'm a farm kid, and it worked out really well. There were still more cows than people. And at that point I was introduced to maternal child health in a way that was really community based. After that, I started my first work on the Navajo reservation and learned about birth from the Navajo women. They came in to Crown Point Hospital for running water and food. Not that they really needed our help in birthing. So it was a unique way for me to be introduced into what I would choose as my career, was as a family nurse practitioner and a nurse midwife. And I went down to Frontier School, which was nurses on horseback then, a small class of just 8 of us, all headed to the mission field in some way, and I was headed back to the Navajo reservation, which I did. By twists and turns, I ended up getting my master's from University of Kentucky while I was at Frontier, and then on to get my doctorate at University of Utah, because of the idea of health education was really important. And maternal child health is the way that you address population health. It's where we have the most dangerous 24 hours in a woman's life with birthing and postpartum. 1 in 17 women still dies in their childbearing time in most of the areas that I work. Sub-Saharan Africa, Haiti, and India. So 1 in 17. And I think probably the most inspirational thing that I learned globally with my colleagues who are nurse midwives and nurses is the fact that women are forever grateful about you coming alongside them during this journey. And even though, for instance, in Tanzania, when I worked a year with Seed Global Health and Peace Corps, when women put their hands on your face after they're delivered safely, it is a universal language that we have for each other. They haven't bled to death, their baby is alive and well, they know that you have been by their side, and reminding you all that this is without any medication or anesthesia for childbirth. In areas that are X-rated, in facilities that we are all birthing in one room, without sheets, without sometimes medications that are part of that global supply chain of medications that doesn't arrive at the end of the road. So that's my specialty, end of the road maternal child health care.